be
Okay,
nice.
right. I'm sorry. Right, shall we start? I'm very sorry, it's due to the connection problem, right?
Okay, now you can start it.
Okay, sorry. Okay. So before start the my presentation, I will give a pre-assessment. So each questions I give 2 minutes. So you can mark true or false for these statement. Now I move to next question. Third question.
Recording in progress.
Am I audible? Hello, can you hear me?
Yes, ma'am.
All right.
You can
So
start.
I think now you have finished and write your answers. So end of this session, I will discuss the answers, and this is the content of today lesson. First of all, I will discuss the specimen collection and transport, and then specimen identification, labeling, uh, fixation requirements, and basic grossing techniques. So this is the basics of histology techniques. Uh, in specimen collection and transport. So first of all, we will see what are the specimen we received for the histopathology techniques. Mainly, we received biopsy specimen and autopsy specimen. So what is the biopsies? Biopsy means when we define the biopsies, it should be a small piece of lesions or tumor which is sent for diagnosis or before final removal of the lesions or the tumor. And autopsies are also called necropsy, postmortem or postmortem examination, dissection and examination of a dead body and its organs and structure. So in summary, we can biopsies are the live body parts and autopsies are dead body parts. Other than that, we receive body fluid, urine such as urine, sputum, CSF, and pap smears. Those are the cytology specimens. In histopathology means we examine the tissue. So other than the tissues or biopsy or autopsy samples, we received cytology specimens also. So all the samples we can categorize into 5 types, 5 groups. For an example, category A belongs to the specimens such as endometrium, breast specimens. So those are in category A, and category B contain skin biopsies or cervical leads, and group C specimens belongs to gallbladder, appendix, hemorrhoids, and group D pigmented skins and salivary gland, and group D belongs to thyroid. Actually, it's depend on the protocols used in different histopathology laboratories. So mainly we group these samples for process to support the processing. So I think in your laboratories, maybe you cannot group like this, but in it's difficult to in practically. So and first of all, we have to collect the samples very perfectly, because if we do the mistakes during the sample collections, these it can be effect for the whole sampling process, including tissue processing, microtomy, and staining. So correct sample collection is very important, especially in histopathology, because we cannot, not like in other specimens such as blood or body fluids, we cannot repeat the histopathology specimen. So correct sampling collection as well as the transportation is very important. Same as in other specimens, in histopathology, sample collection container is very important. For the histopathology sample collection, those are the features should have. The containers, it should be leak-proof and with wide mouth. It should be unbreakable. So that means we cannot use glass container. We have to use plastic or polypropylene containers, and it should have large enough to hold the specimen as well as the adequate volume of fixative. So adequate volume of fixative means the ratio with the tissue and fixative should be 1:20, right? That is the adequate volume. Then specimens from different sites taken at the same surgical procedure should be sent in separate containers with one request form. So this information taken from the protocol, the current protocol used in Sri Lanka, right? So so sometimes questions can be asked. Write the properties of histopathological container. So your answer should be contain these important points. So it should be leak-proof with wide mouth, and it should be polypropylene or plastic container. Glass containers cannot be used, and it should be the large enough to hold the specimen. That means for large specimen we have to use large containers like this, and for small samples we can use this type of small container, right? And next important point you have pay your attention is sample labeling. So those are the information you have to mention in labeling. So these information or these instructions you have to give your surgical ward staff as well as the theatre staff. So in verbally or in writing. So in writing instruction, that means you have to give the sample reception criteria, right? So those are the sample reception criteria. We can include that. So those are the information mentioned in the label. So when you accept the sample in your laboratory, we have to check whether label contain those information, right? Such as patient name, identification number, that means the BH, bed head number, age, ward, and analytical site and exact location. The location also very important, and then type of surgical procedure, date and time of collection, and test requested. Then we come to the detail provided should be included in request form. Other than the type of site of samples, the especially clinical details should contain such as radiological findings for bone tumors, liver function tests for liver biopsies, and renal function tests for renal biopsies, and PSA levels of prostatic biopsies, etc. And and where available the clinical different diagnosis, right? So other than the patient information, those informations also useful for our diagnosis. And reference numbers and diagnosis of any previous relevant fine needle aspiration or histology reports. In addition to that, an indication if the report is urgently required. Another important point is if orientation sutures are placed, the margins they represent should be clearly indicated, right? Those are the information the authorized people should mention in request form. So when you accept the sample in our laboratory, we have to check whether the label and request form, information mentioned in the label as well as the request form should be tallied, right? Those are the important points we have to consider. So then, for above information, the questions can be asked, what are the sample acception criteria or reception criteria? So I assume that now you can answer this type of question, right? And so during the sample reception, you have to check the sample should be properly labeled, right? So it should be, the label should do not cover whole specimen, right? This is the wrong labeling. Then container should be as I mentioned earlier, container should be screw capped, leak proof, and adequate and have a wide mouth for large specimen. So in here you have to mention the volume of the fixative. It should be 1 in 20 times, right? And the container should be made of non-reactive materials. The most suitable material is polypropylene plastic, right? So the containers made of glass are not appropriate because glass containers can be breakable, right? Then we move to the fixation. So actually sometimes the questions can be asked, define the fixation, what are the fixatives, those kind of questions can be asked. So let's see what is fixation, right? Fixation is a complex series of chemical events which preserve the tissues in as close a lifelike state as possible by preventing their autolysis and putrefaction. So if this is the more general question, what is fixation? So your answer should be contain these main words: preventing their autolysis and putrefaction without change the lifelike state, or it should be prevent the architecture of the tissue without doing autolysis and putrefaction. So fixation is a complex series of chemical events which preserve the tissue in as close a lifelike state as possible by preventing their autolysis and putrefaction. And it should be done immediately after biopsy is removed from the body. That means time is very important. So fixation should be at within 30 minutes of after removing the body. So during this process, the semi-fluid state of the cell is converted into a semi-solid state, thus maintaining the morphology and structural details of the tissue. So this is the main aim of the fixation, right? The aim of the fixation is prevent the autolysis and putrefaction. So you can compare the two images provided. This is the well-preserved tissues and this is autolyzed tissue. So if questions ask what happen if fixative is not used, right? Let's see what are the fixatives. A fixative described as a substance which will preserve shape, structure, relationship and chemical constituents of tissues and cells after death, right? Fixative can be described as a substance which will preserve shape, structure, relationship and chemical constituent of tissues and cells after death. That means preserve the architecture. We can simply say preserve the fixative can be preserved tissues architecture, right? It is mainly due to the action of fixative on the protein element of cells and tissues that the structural stabilization is achieved. So when we use the fixative reacts with the protein element in tissue. That is the fixation mechanism, right? I will explain it later. Those are the basic aims of fixation. So simply we can say to preserve the tissue nearest to its living state, to prevent any change in shape and size of the tissue at the time of processing, to prevent an autolysis, to make the tissue firm to hard, to prevent any bacterial growth in the tissue, to make it possible to have clear stain, and have better optical quality of the tissues. We can explain it simply as mentioned here, right? So if the questions ask what are the aims of fixation, so you can write your answer in simple way like this, right? Try to memorize to prevent the tissue nearest its living state and to prevent any change in shape and size of the tissue at the time of processing, to prevent any autolysis, to make the tissue firm to hard, to prevent any bacterial growth in the tissue, to make it possible to have clear stain, and to finally to have better optical quality of the tissues. You have to memorize at least 3, 4 or 5 points from here. And again, you can pay your attention for characteristics of fixatives. What are the characteristics of fixatives? So, it must kill the cell quickly. And in doing so, should produce the minimal distortion. Secondly, it must penetrate the tissue and cells rapidly and even. It must render insoluble the substance of the cell and give good optical differentiation. It must inhibit bacterial decay and autolysis. It must harden the tissue and render it insensitive to subsequent treatment. It must permit at a later date the application of numerous staining procedures in order to render the constituent of the tissue and cells more readily visible. So actually, generally, these features, those are the features should have contained the fixatives. Right? Mainly there are 6 points. So I think you can understand the meaning of these. Then mainly we can categorize the fixation into 2 methods. We can use chemicals such as formal saline and sinker fluid, boiling fluids. Those are the chemical fixatives. Right? Then we can fix the tissues or sections by using physical methods. Physical methods are heat, freeze drying, and microwave. Mainly there are 2 methods, chemical fixation and physical fixation. So you can give examples for each method. Again, we can categorize chemical fixatives according to chemical nature of the fixative and according to the fixation mechanism of the fixative. Generally, we categorize the fixatives according to the chemical nature, right? But to understand the mechanism is very important for fixation to when we use some different staining technique. So according to the chemical nature of the fixative, we can categorize into mainly simple fixative and compound fixative. Simple fixative means this type of fixative contain only one chemical, right? Formal saline, mercury chloride, oxalic acid, citric acid, acetone, those are the simple fixatives. Compound fixative contain 2 or more chemicals. Again, we can categorize compound fixative in 3 categories: microanatomical fixatives, cytological, and histochemical fixatives. Microanatomical means we may fix the micro contains in tissues. Cytological fixative means especially for cytological specimens, so nuclear and cytoplasmic component we can fix. As an example, nuclear, we can fix the carnoid fluid like that, right? According to the fixation mechanism, there are main 3 categories: coagulant fixatives, dehydrate coagulant fixatives, and non-coagulant cross-linking fixatives. For actually, this categorization is important because to understanding the mechanism, it's depend on the fixative we use, right? For an example, so I already explained this classification. I'm not going to explain it again. Right? Those are the examples for each category. in Sri Lanka, we use 10% formal saline. So this is the fixity we use. But in nowadays, we use buffered formal saline because most laboratories use buffered formal saline because its effect for the pH is effect for the staining reaction, right? So the most suitable fixative is 10% buffered formal saline. So for understanding the fixation mechanism, first of all, we have to understand the protein structure because mainly there are four structures: primary structure, because the only one chain, and secondary structure, tertiary structure, and quaternary structure. So because then when we add the fixative, the chemical in fixative arrange according, they make the link with protein structures. We'll see how it happens, right? For an example, if you alcohol as a fixative in the mechanism, water molecule is removed, right? So then the tissue will be dehydrated and coagulation of protein, right? If we use alcohol, in the mechanism, due to the alcohol, water molecule is removed, and then tissue will get dehydrated and coagulate the protein. So that is the mechanism of alcohol, right? So if you use formaldehyde, right, it cross-link with protein, the hydroxymethyl anion cross-link with this protein, right? That is the mechanism. That how the tissue preserved by using formaldehyde, by cross-link with protein. And if you use osmium tetroxide, glycol osmate ions, cross-link with lipid. This is the main three fixative categories and mechanism. In alcohol, by removing water molecules, then tissue will dehydrate and coagulate the protein. In formaldehyde mechanism, hydroxymethyl ions will link with the protein. And when comes to osmium tetroxide, in here, the lipid ions, glycol osmate link with the lipids, not the protein. Right? This is the mechanism. So understanding the mechanism is very important when we select the correct fixative. For it depends on our requirement, right? So when selecting the correct fixative also very important. And let's see what are the factors effect for the fixation. What are the factors effect for the fixation? Mainly temperature. Then pressure and pH. and strength of the fixative. That means the generally we use 10% formal saline, right? Then salt in constant, which express the contribution of the electrostatic interactions. The types of denaturing reagent, mainly the main factors are temperature, time, and pH. Those are the main factors effect for the fixation. Temperature, pH, and time. Actually, fixed sample we use for routine stain, eosine and hematoxylin and eosine stain, IHC, and for special stains. But sometimes we receive frozen samples. Frozen samples means tissues are sent in fresh or in normal saline, right? So for ongoing surgeries, so if the report should be get urgent, at that time we receive frozen samples. Other than that, for lipid, some substances such as lipids and enzymes, we use frozen samples because by adding fixation, those substances can be destroyed, especially lipids and enzymes. Another important point is, especially for the immunofluorescence studies, the sample do not fix. Other than that, if the sample received in 10% formal saline, we cannot process these samples for immunofluorescence studies. For immunofluorescence studies, samples should be sent in normal saline or Michel media. Michel media means the transport media, right? Those are the important points you have to remember. Now we discuss the grossing. So grossing generally we call cutout, right? In here, first of all, you have to identify what are the requirements or the equipment you need in grossing station. Can you guess? Look at this image. We need clean cutting board, knife, scissors, ink, hand lens, measuring tape. So if the question asks what are the requirements you need, then you have to at least 5 equipment what I mentioned here, right? In grossing specimen involves accurate naked eye description of intact specimen. So for that purpose, you have to measure the specimen and appearance of the you have to take the record, right? And uh, correct method of sectioning also very important. So that part done by the MO pathology. So but you have to know what are the important points you have to pay your attention in this step. So as I mentioned earlier, can you list the requirement? Hello? So can you list the requirement using grossing station? You can use the, you can write your answers in chat. Can you hear me? Am I audible? Mr. Dinesh?
Yes.
Oh, right. So what are the requirements you needed at grossing station? Knife, forceps, what else? Measuring tape, ink, cutting board, what else? You can, yeah. Tissue cassette, nice, ink, ruler, hand lens, cutting board, acetic acid, magnifying glass. Yes, good. Thank you. What is cross-contamination? What is cross-contamination? Carryovers. Sample can be mixed with its when with previous specimen. If we don't clean our cutting board or forceps well, so specimen can be mixed up. How do you avoid that error? How do you avoid? Carryover effect. How do you avoid the sample mix-up during the grossing station? What are the quality control measures apply here? Washing cutting boards in between samples, good. Cleaning everything after each specimen. Thank you for your answer. Taking one sample at a time, good. What else? Proper cleaning every step. What else? Or I can ask question like, what are the quality control measures we can apply here? What are the quality control measures we can apply here? Check in the request. Open one sample at one time. Same type of specimen should not take continuously. So can you give the example, Ms. Surangika? Same type of specimen should not take continuously. We have to change the specimen. If we process the breast, next time should be uterus likewise, right? Correct numbering, proper labeling. But at one time we have to open one specimen. Those are the quality control measures we can apply here. Right. So we come to the end of the session. So I explained sample reception criteria, suitable container to collect the histopathology specimen, and then we come to the fixation. We discuss the type of fixatives and fixation methods, properties of fixatives. And finally, we discuss the process station, the requirement, the requirement of required equipment of glossing and quality control measures of glossing. So now you can check your answers for these questions. I like to get your answers for these questions. For first question, so is it true or false? First statement, sample label along with the request form should be checked. Is it correct? True or false? True. Yes. And second one, volume of a fixative is not important. True or false? False. Type of specimen container is not considered. True or false? false. D, specimens should be stored out according to their size, type, and urgency. Specimens should be sorted out according to their size, type, and urgency. It's true. Giving a reference laboratory number with the year. Correct. So in here, A true, B false, B, C also false, D and E true, right? Second one. Surface area of tissue has no effect on fixation. True or false? False. Can be optimized by cooling the fixity. True or false? Actually can be optimized by heating the fixity, not cooling. 2% glutaraldehyde is recommended for fixation of tissues for electron microscopy. True or false? True. Sorry. A compound fixative has only one continuant or chemical. True or false? Only one. False. Time has an effect on fixation. True. That means time is one factor for fixation. There is one question. 1 in 10 volume by volume, right? Actually, according to the guideline given by Sri Lanka College of Pathologists, it says 1 in 20. Right? But most references say it should be 1 in 10. But in guidelines given by College of Pathologists, that guideline mentioned 1 in 20. So I will give my answer for this question tomorrow, right, Mr. Suravira? Right? Okay. Next one. 10% formal saline prevent autolysis. True or false? True. Soften tissue. It hardens the tissue. Is used as a clearing agent. It is not a clearing agent, it is a fixative, right? So clearing agent are silane. Prevent bacterial decomposition. True or false? Remove fat and glycogen. I think time is passed. So shall we move to the next question? Tissue fixation. Cooling the viscosity to 20 degrees Celsius. True or false? It's true. False. Using 5% formal cell line. False. By bisecting large tissues before placing in formal cell line. True. Adding pixel twice the volume of the tissue. False. Adding HCl to the fixative. False. So, no, it is not the very good question. Right. Then come in to this one. List 5 equipment used in this station. So this is the grossing station. So as we discussed in earlier, you can write answers for this first question. Then what is the purpose of sutures seen here? So what is the purpose of using sutures? Write your answer. Please write your answer in chat box. To mark orientation. Correct. Thank you. Other than that, we can use ink for correct tissue orientation, right? So write 2 quality control measures you can apply here. We already discussed answer for these questions. Quality control, at the beginning, proper labeling, identify the organ, correct numbering, and checking the request form. Same type of specimen should not take continuously. Those are the precautions we can take here. Or quality control measures. So we can maintain the quality of tissue grossing or cut-up by doing above mentioned activities. So define the tissue fixity. I already explained it in the presentation, so you can find your answer and comment on the fixity volume. So what is your answer? Regarding this? What is your idea? The volume is correct. Are you satisfied with this specimen? Do you accept the sample, this kind of specimen for the processing? What's your idea? What is the strength of formaldehyde used in the preparation of formal saline? We use 40% formaldehyde. So what are the other chemical we need to prepare formal saline? 40% formaldehyde, and to prepare the 10% formal saline, we need normal saline. For prepare normal saline, we need sodium chloride, right? So what are the requirements we need to prepare buffered formal saline? Buffered formal saline. So the answer should, for first question, you know the answer, 10% formal saline. If the tissue keep in above fixative in prolonged time, what has happened to the tissue? What has happened to the tissue? I like to find your answer. I know you are not prepared to talk with me, so please write your answer. Use the chat box. So active participation is very important. Formalin pigment. Right, right. So how do you remove formalin pigments? How do you remove? Mr. Suravira, I am waiting for your answer. What are the chemical we can use for remove formalin pigments? Bleaching, yes. For bleaching, so what is the correct procedure we can apply here? It is the mechanism. So using saturated alcoholic picric acid or 10% sodium hydroxide, you can remove formalin pigments. Actually, if blood is do not remove properly, So if the specimen contains blood, so blood can react with the formaldehyde. So if the blood react with the formaldehyde, forming pigments can be appear, right? So that is the one trouble we can face in tissue fixation. So what is the correct time duration? It's depend on the size of the specimen. For small specimen, what is the correct, curating, so like that, its fixation should, at least the specimen should fix 6 hours. The minimum 6 hours up to 72 hours. That is the time duration. Am I correct? 6 to 72 hours. So my next question is, what are the main problems? So due to the fixation, what is the underfixation? Underfixation. What is underfixation? The tissue is not, yes, poor fixation or underfixation, no, yes, not proper fixation due to inadequate time, right? So what is uneven fixation? Uneven fixation. Uneven fixation. Uneven fixation. It's due to poor penetration of the fixative. So it can be happen due if the tissue adhere to the bottom of the container or wall of the container, or if specimen do not bisect, right? So uneven fixation is the fixative not penetrate or whole tissue. So what is the overfixation? Overfixation. Overfixation. Yes, prolonged fixation. So what are the problems can be occur due to prolonged fixation? Hard enough. Poor staining, forming pigments, due to prolonged fixation? I don't have that idea. IHC stain not curve. What else? Cannot sectioning evenly. Actually, fixation effect for the every process, the microtomy and staining. So how do you check the quality of fixatives? Quality. It's the quality control measure. So how do you check the 10% quality of 10% formal saline? After preparing the 10% formalin, generally you have to check the quality. Using shift reagent? No. So I think the melt is in accredited laboratories. They should check the quality of fixatives. Yes, by checking specific gravity and pH. Specific gravity and pH. Yes, thank you, Mr. Sudhavira. So what kind of problems we have to face due to poor fixation? Due to poor fixation, poor fixation may be uneven, under, over fixation, over fixation, uneven fixation. So what are the what kind of problems can be happen during microtomy and staining? Yes, not staining properly during microtomy. Before cutting the sections or the microtome. Yes, inadequate cellular details in during after staining. My question is during microtomy. Yes, cannot get thin section, brittle the sections, it's uneven thickness. So you have to give the reason. So due to over fixation, cutting difficulties. So actually you have to give the direct answer. So due to uneven fixation, tissues can not hard enough to get the thin section. And due to the over fixation, section can be brittle. Right? Likewise, you have to give the direct answers for each question. Full section not coming means cannot perform the ribbon. And cutting difficulties. It is not, actually you have to explain what are the difficulties you can face. You have to write the direct answers for it. First of all, you have to understand the question and then write the direct answer for each question. This compulsory. So then you can get the full marks. Right? So like full section not coming, cache artifacts, yes. So what are the artifacts? Artifacts related to fixation? Pigments, especially formalin pigments, and what else? Now we do not use the mercury content fixative. So earlier we used, so mercury pigments can be appear, but nowadays we do not use the mercury content fixatives. Right. Generally, you should know if the specimen, it's depend on specimen and the staining technique. You should know the suitable fixative we have to use, such as for the lipid, to demonstrate the lipid. So what is the fixative we have to use for lipids demonstration? Remain 10 minutes more. Please write your answer. Can you hear my question? For lipids. Enzymes. For demonstrates enzymes. What is the most suitable fixative you have to use? Normal saline. Normal saline. For lipid, no, not acetone. For lipid, enzyme, lipids, enzymes, and immunofluorescence studies. What is the most suitable fixative? For demonstrate lipids, enzymes, and for immunofluorescence studies, we do not use fixatives. Sample should be sent in normal saline or in using transport media such as visual media. Yes, we use frozen specimen for lipid studies, immunofluorescence studies, and enzymes. Because during the tissue processing or the using chemicals, those substances can be destroyed, right? Especially enzymes and antigen antibody complexes and lipids can be destroyed. So we do not use fixative for demonstrate those substances, right? For electron microscopic studies, what is the fixative we have to use? What is the most suitable fixative? So you have to write the concentration, my dear. Yes, 2 to 4% glutaraldehyde. Yes, correct. Correct. Now we come to the end of today's lesson. If you have any questions, now you can ask. I think you most prefer to use the chat box. So if you have any questions, you can write. If you have any questions, you can ask now or anytime. Anytime. Right? I think you have my number. Next question. Do you accept these samples? No, because these specimens sent in normal cell line, right? Especially, but in this question, this is not mentioned. No, routine histopathology means for H&E stain. So in normal cell line, we cannot, but especially in histopathology specimen, we do not reject the specimen. So we have to change the normal cell line and add the fixative 10% formal cell line in correct volume. So, right? So that is the action you have to take. In this is the last question. What is the equipment used to obtain this image? This is the electron microscope image. So name the fixative used here. 2 to 4% glutaraldehyde we have to use for electron microscopic studies, right? So now we come to the end. I think you don't have any questions. I hope you understood everything. Right, okay. Right, then shall we end? Have a nice day. Good night. Thank you very much.
Thank you, ma'am. Mrs. Subha
Okay.
Jayasekara, our senior tutor at MRI. Thank you for your valuable support and conduct our online refreshment training.
Thank you.
Thank you. Smooth presentation and I think very easy